Hi everyone, my name is Caitlin Gillian. I am an instructor here at Seminole State College in the Public Safety Department. Today we are reviewing the ambulance and all of the ins and the outs of the ambulance itself. I do want to make a quick disclaimer and say that this is our ambulance, and every ambulance across the state of Florida, across the nation, does have a different setup on the inside. So what we see here today is not going to be the same for your department. Every interior of the ambulance is different and every exterior is different, even if it is your ambulance that you routinely work on. We always want to check off the truck, make sure that it's right, and that we can continue our patient care in a safe manner. Front cab and see what starts there. So now that we're in the front of the cab, we're gonna make sure that our truck is ready for our shift. We're going to check the oil levels, the gas, so that it's full or at least 3/4 full depending on your county's protocols, your station's protocols, and check the mileage as well. Typically you have to write that down in a book. So after we check off the logistics of the truck, we want to make sure that all of our lights are working. We have the lights that we have on the outside that flicker. We also have the lights in the patient compartment of the truck itself that I am able to control with some of the switches up here. So we just want to make sure that everything does in fact connect. All right, now we're going to go to the outside compartments. This one typically holds our extra large oxygen tank. So this next compartment on this truck doesn't have anything in it, but it could hold some trauma equipment. It might even hold your gear for the day. On a fully stocked ambulance, this would have materials inside of it. Ours just does not. As mentioned in the cab, we have to make sure that the gas is at an appropriate level for your shift. This truck takes gasoline only, and there's typically going to be a placard on top. Some of them are diesel only vehicles, some of them are gasoline only. So just make sure you're putting the right type of gas into your vehicle. So this is our backboard compartment. It also has a few other features. This one should fit a nice backboard, but this one is a little bit too long, so we've put it over here. We also have a traction splint and then a KED behind this backboard. On this side, in this compartment, we have some of our trauma equipment. So we've decided to put our cervical collars, our headboards with the head blocks. We've got a couple extra straps and our trauma box that our EMT and paramedic students use at this college. Our last compartment on the outside is just an exterior access to what is typically a respiratory door or drawer, but we do have access to this cabinet from the outside. Now let's take a look inside the ambulance. So this is typically called the captain's seat. Either your lead paramedic, your lieutenant, your captain, they'll sit here so that they can have an overview of your patient. From here, we have the easiest access to our oxygen compartment and also our medication compartment. Here I have my life pack. I have an extra sharps container. Typically there's an oxygen insert that goes here, so we can use that big tank that I talked about before. That's unfortunately not in that compartment. And then we do have a suction down here. This is that airway compartment that I was talking about that had an external way to get access. These compartments, they do open very easily. We would typically have our airway bag, like the ambu bag up here. We've got some suction. We also have some tubes that would either be for king tubes for EMTs or endotracheal tubes for our paramedics. Up here we have our glove compartment. It's always important that you have your gloves ready to be used and also an extra set somewhere on the truck. In EMS, we use a lot of things that are called sharps, whether that's using your BGL lancet or an IV or administering medication through maybe a hypodermic needle. Here we have a very special sharps container, and then back here we have a larger waste that is for biohazard. So this is our bench seat compartment. There is a lift underneath. In here we have a few splinting items. Typically you would find wool blankets. You might even find your extra set of stretcher batteries underneath of the bench seat. So as the medic on the truck, you usually have a little IV start kit or a section over here that's got a few IV supplies. Unfortunately, at this moment, we don't have the bins to put them in. So I have this very well put together IV start kit. That way, in the event that my patient did need an IV, I had very quick and easy access to that IV start kit. As mentioned previously, this is our medication compartment and also our airway compartment. We have just a few of the medications that our EMT and our paramedic students will use. I also have some masks, an extra blood pressure cuff, a stethoscope. I've got some safety goggles just in case. And then over here, we have a few items for airway, some nasal cannulas, some non-rebreathers, and a nebulizer kit. I know that this Velcro doesn't look like much, but it does actually have an important piece to our function. In the event that our patient needs to have some fluids, we can hang the bag here on this hook, and then this will strap around the bag itself and hold it in place. It's basically an IV pole, but just connected to the truck itself. In this compartment, we have our extra IV supplies and also our bags and our drip sets. Here are those extra IV supplies. This is one of our drip sets. And then over here, we have a lactated ringer bag. As mentioned before, there are 2 holders for the bags in the back of the ambulance. I have asked my patient which arm he prefers his IV to be on. He does prefer the left side, and I did see better veins on the left side. So to make sure that the bag is on the same side as the IV, I am going to remove it from this spot and place it onto the other side of the ambulance. When you have finished with your patient, all I ask is that you please pick up your trash. It makes it better for the next patient you have coming in and also for your safety. All right, so we have decided to make this compartment our trauma compartment. It has some cling and acrylics, got a couple of SAM splints. We have some abdominal pads, some tourniquets. We have an extra set of shears, more sponges, some band-aids, some tape, some 4x4s. Typically there's a lot more in here, but again, we are just stocking to the best that we can. In this bottom compartment, we have decided to place our OB kit. It's really important that we always know where the OB kit is, because in the event someone is having active labor, this has all the materials that we could possibly need to help deliver this baby safely and get them to the hospital. So this is the last compartment that we're gonna go over. In here we have some isolation equipment. We have our extra set of gloves that I mentioned earlier. We also have some electrode dots that we can use with the LifePak or the Zolt. That way we can perform 4-lead or 3-lead and then also a 12-lead EKG. We also have these emergency yellow blankets. We use these with our patients who have either blood or vomit, or they've defecated or urinated on themselves. Just keeps them kind of nice and packaged inside the stretcher. First, I just wanted to thank you all for watching this video and becoming familiar with the ambulance itself. I hope that this was valuable information that you can take to your department and through EMT and paramedic school. Hope to see you on the next video.